Rhonda Masad. We can reduce spreading infections and flus and viruses 50% if we wash our hands properly. Only 5% of people actually wash their hands properly. And if we could fix that, we would be able to reduce our spreading of disease by 50%, considering the backlog of 200% at the hospitals, the virus that's all over the news. Let's be honest, we've got to do better, and I think this is one of the most critical ways that we can do that. 80% of germs and infections are spread through hand-to-hand contact. So that is why we're doing this today. I have spoken to the hospital and they have showed me how to wash my hands properly, and I'm gonna run that through with you so that we can do better as a people when we're washing our hands. First thing you need is a very substantial amount of soap. So I do 2 squirts. You rub the soap the way we always do, that's fine. And what we have to do is warm water. And I've got a very hot water thing going on, so I have to be careful. So warm water, we rub as we always have. We have to do this. We're not doing any of the finger knitting and in between this part of our hands. We kind of leave that out, and I'm to blame here. So I do that too. You have to knit your fingers together, up and down, and you have to wash your thumb base like this. According to the hospital diagram here, it will be part of the post, so you'll see that. What we do now is this. Why do we do this? Because it cleans the underneath of the nails. We need to get under there and make sure that the soap is inside the nails. I keep my nails short, but especially for those of you that keep them long, please do this. So get a little bit of more water, because I find I want to soap up. You got to do this part, as they say here. Item number 7 is to wash the inside of the thumb. Like this, we have to do this. This is item number 8. We do this. And we scrub. The whole process should be taking you 40 seconds. You rinse in hot water while that water is hot. It's a really beautiful hot water. And we got to reduce that. So there, we have rinsed. I'm knitting my fingers together even during the rinsing process. You need to wash your hands after blowing your nose, after using the toilet, after changing a child's diaper or wiping your child's nose, after handling garbage, after touching your pet. When you come home, wash your hands if you've been in a public place. It's important to wash your hands. I also sanitize my steering wheel in my car and my the controls within my car. I will take a wipe and wipe those periodically, so that's an important part too. Door handles, light switches, sanitize those in your home. So before you handle food, you should be washing your hands. Before you eat, before you put in your contact lenses, that's a big one. So take that before you take your medications. Anything that you're putting into your mouth, you've got to wash your hands before. So it's, like I said, 80% of germs are spread through hand-to-hand contact. I ask that maybe we can stop as a community holding hands, shaking hands. I mean, everybody knows that right now we'd like to reduce this. So yes, as much as we want to be friendly, maybe that fist pump is the better option. Maybe no kissing. We can say hello and just like let it go for the next couple of months while we all get through this terrible crisis that is very scary, and we need to do better. So could be a way that we as people can help ourselves. Washing your hands as you come in the house is critical. Take care to do 40 seconds worth, and all the diagrams are within this post. So I'm hoping that we can reduce 50% of the germs that are being spread by simply washing our hands. So I ask you, the hospital is asking, this is a request that was made, that we can spread the word. Please share this post, because it's an important post that we all learn how to wash our hands properly, and we do so in order to alleviate this infection crisis. So I wish you a great day and a very healthy upcoming season.